My name's Casey Quinlan. I'm a graduate of the UW Anesthesia program in 2019, and I stayed on at Seattle Children's Hospital and did a fellowship year, and am faculty there now.
Hi, I'm Rajeev Saxena. I graduated the program at University of Washington in 2021. I went straight into private practice, and I currently work for Matrix Anesthesia at Overlake Hospital.
I'm Teresa Jiang, and I am a current CA3. I'm one of the chief residents at the VA in Seattle Children's.
And I'm Camellia Baldrige, graduated in 2018, did a neuro fellowship, and I went into private practice at USAP Washington at Swedish Hospital in Seattle.
Hi, I'm Patricia Rodriguez. I am also from the residency class of 2021. I did a pediatric anesthesiology fellowship following graduation, and now I work in private practice in the area at Matrix Anesthesia, but at Evergreen Hospital.
One of the things that attracted me to the University of Washington was the breadth of exposure that you have here. When I interviewed at other programs around the country, it seemed like, especially in cities that are very concentrated with many hospitals, that experience gets separated out to different residency programs, so you don't get as much exposure. So what drew me here was the big four hospitals, VA, Seattle Children's, UW, and Harborview, and how much opportunity that automatically affords you.
How do you feel like that experience translated to stepping into your role as a new attending?
One of the biggest pressures as an attending anesthesiologist is being able to be the person that shows up into a crisis situation and manage it. And when you've dealt with multiple incredibly challenging clinical scenarios during your training, you can step into that role much easier.
Yeah, and I would just add that I feel like the size of our program was a huge advantage as well, because there was being in such a large program with multiple hospitals, the opportunities for mentorship were really high. And so just today I was mentoring somebody who's starting this journey, and I was thinking back to all the different people that now influence my practice. And only 2 years out, I don't think there's been a single day that I haven't felt prepared for, whether it's a really challenging epidural at 3 a.m. when I'm on OB, or an MTP, and all of these situations happen. And in private practice, you're often by yourself, and you can always call for help, but there's not been a day since I felt like UW hadn't prepared me, and I'm really grateful for that.
Is there any specific memory that you have of a clinical experience you had that you think about now, or you think really shaped what or shaped your clinical practice now?
I think the first thing that comes to mind was the largest, most active MTP I was part of, where we transfused, I think, 135 units of product, which I don't think I will see again in my career. But I think in a training program, when you test the limits of physiology and you test the resources of an institution, those types of pressure tests in every dimension, also testing your own ability to administer the resuscitation, those are very formative. I think that there are a lot of lessons there in terms of debriefing how to handle those situations, what's medically appropriate, and there are a lot of ethical and practical considerations. And when I think about those cases, it makes a straightforward MTP feel very easy to manage.
Do you feel like UW really shaped your decision to do fellowship or to work in a private practice afterwards?
For me personally, I felt like rotating at Seattle Children's was like finding my people and my family. So I think after that, certainly it shaped my desire to do pediatric anesthesia, and even going into the fellowship application process, I felt really strongly that I wanted to be there. That being said, I think that this program does a really fantastic job of embracing what each resident wants for their future. There's not really just one trajectory that the program supports, and I have colleagues who went into private practice, community practice all over the WWAMI region, who went into academic medicine here or anywhere across the country, who went into primarily research roles, or who trained in fellowship in a variety of paths. And I also have colleagues that I trained with who've gone through many of those avenues now, even just a few years out.
Did most of the people in your classes do fellowship or go into practice?
I think our class, Rajeev, had a pretty standard breakdown where 10 to 11 people went into fellowship. The remainder of the class went straight into private practice, and then a little biased, but of the people who go into fellowship, like a full third of them go into pediatrics, just like me and Casey.
I think that's pretty remarkable for an institution that has so many academic resources to not try to kind of filter everyone into the same pathway. I genuinely think like the leadership here sees individuals for their strengths, recognizes that a career is long, and that statistically most of us will have multiple jobs in multiple different practice environments around the country, and they support that. And I think that leads to a really rich alumni network as well, and the capacity and ability to transition throughout your career.
Of the people you trained with, do you think a lot of them stayed in the area, or did they go elsewhere?
In my class, a vast majority of classmates left the area, and I've seen that shift with the subsequent graduating classes.
I think that there is a mission that the program is committed to for training residents who want to work in the WWAMI region, and so there's certainly I think a trend in many classes for some people to be staying in the area, but I think in almost every case there's examples of people who took jobs that they loved all over the country.
Yeah, I mean, in my class, the fellowship match for cardiac and pain just happened, and I know that some of my co-residents are already thinking about their next steps. So do you have advice for people who are looking at their first jobs, or what things that you wish you would have learned more about in residency, or took extra time to get experience in?
I think most private practice environments are going to demand a fairly broad scope of practice. You're really going to need to be able to show up and do anything from a regional block to intracranial case. You know, there's very few things that are truly subspecialty specific or regional or specialty. Cut that part out. Oh God. All right. Next question. Right though, like you have to be able to do everything.
Yeah.
Oh, yeah.
Yeah.
I think that, there's always going to be on-the-job learning as well. Like, we don't finish residency or fellowship and just stop growing, right? And that continues throughout your life. But my advice would be, as you're thinking about next steps and career, is really go tap into the people that you know and the friends of the people that you know, and get on the phone and talk to people in the group. Don't settle for generalizations about practices, because often things look quite different on the inside versus the outside. And a beauty of a big program with so many amazingly trained people is that you can really learn about what are the pitfalls and strengths of different practice environments. It's so hard to imagine when you're a resident what it's like to work in these different spots. And so I do think more than anything, just talking to people about the specifics of what they like and don't like about their job can help kind of see if it's a good fit.
Yeah. As you were towards the end of your time in residency, do you feel like you had mentors who helped you to find what you were looking for from your career or in your next steps?
I mean, I think that's an awesome part about being part of a big department, is that you can find faculty who've had all different paths to coming here and who have either other colleagues that they know in other places or have expertise in other areas, that as you grow into a new interest, you can find somebody who can mentor you in that regard, or who has experience with that path.
I think one thing about that too is sort of medicine in general doesn't really prepare anybody for job interviews or job considerations. And so oftentimes mentors are happy to help, but none of us are really trained in how to help. And so thinking about, well, I'm looking at private practice, let me interview at multiple places and just see for myself. Let me talk to people who have done different fellowships to try to allow you to make a more informed decision. Sometimes you apply to multiple places and they're all on different timelines, and you never actually get to learn about any of the groups. You just have a job offer, you have to decide. So I think just like anything else, but especially true in medicine, being really proactive about your fellowship search, about your job search is rewarding.
Well, and as Rajeev mentioned, our alumni network is massive. We're countrywide, and I'm on the recruiting committee at my current group, and anytime somebody applies anywhere, I'll get a message like, hey, anybody from the UW, hey, do you know so-and-so? They've applied to a group in Dallas or whatever. So it's a very large network and a small group of anesthesiologists nationwide that you can really tap into.
Yeah.
KC 2.0. A strong resume.
So, I mean, in my class, people came from a lot of different places with a lot of different backgrounds. So, from your experience, do you have any thoughts about what makes an ideal resident in general or for this program?
One of our biggest strengths is the breadth of exposure, all of those different clinical experiences at different hospitals. What makes us strong resident is the ability to dive into all of those different situations and not feel overwhelmed with, where's the locker room, a new computer system, new attendings. It's really something to think about when you're considering this program, because there are other places that are much smaller where you might be at one hospital for all 4 years, and that might be a better fit for some people. But a strong resident here can be adaptable and really jump into any clinical situation at any location.
Yeah, I think our program is one that gives residents autonomy really early on. And I think being someone who can balance that autonomy with asking for help. Actually, I remember Camellia taught me this when I was a CA1. She said, I page my attendings and I say, this is what's going on, this is what I'm gonna do. Now I've looped them in and they can come and give their advice and participate, but I'm gonna take the autonomy. So I think being comfortable in that position and learning how to navigate autonomy sometimes in uncomfortable situations that maybe feel a little bit beyond your comfort level. And then I think no matter where you are, a successful resident is someone who takes advantage of all the learning opportunities and really sees every day as a learning opportunity, even when it might feel like the service education balance is in favor of service.
I think it's important to consider what your future job might be. A lot of us go into it thinking academics or private practice, but the reality is there's a lot of different practice models out there, and different residency programs are going to prepare different people for those pathways more effectively than others.
I think also sometimes in residency you get so fixated thinking about just the clinical model, but you forget that these are academic institutions with university resources. And so for me, a big part of my residency was projects in operating room management and looking at computer science and data science, and we're in Seattle, it's sort of a tech mecca. There's lots of interesting people coming in that you can meet socially as well. And so it's hard in residency, right? You're working a lot, but you have choices every time you're post-call, or that you have a facilitating day into how you want to spend the time. And sometimes when you think about a university, you have an opportunity there to do projects that you may not do once you're done with training, but you have the opportunity, whether that's global health, whether it's business side, whether it's practice of medicine. There's a number of different things that University of Washington's super strong at, and are not force-fed to you, which is also really nice, but is also there with all our faculty doing projects all the time looking for help.
Yeah, we do have a scholarly requirement but the involvement that scholarly requirement asks of you is very variable depending on what you're interested in. So what did you do for your time?
Yeah, so for that, I was doing work in sort of quality improvement using data metrics in the operating room to track operational, financial, and clinical stuff. So I think for me, I had an existing project, but I know that when people were looking to fulfill that requirement, everyone was kind of in it together to be there are ways to do this and just satisfy the box, but there are also ways to do things that would be interesting. And if you can lift your head for a moment from the clinical grind, there's actually a lot of really interesting work, and I think a lot of people in our class had really great projects.
Yeah. Was that project an intentional choice? That's something you were interested in looking into later in your career as well?
Yeah, I mean, I think I knew that I was interested in it, or that I've always been interested in more than direct clinical medicine. So I kind of sought some of those opportunities out. But I think separate from me in general, I think when you talk to all of us, you know, we all think about different environments we could thrive in, and there's always trade-offs, right, for whatever practice environment you're in. And so I was really excited by a lot of the opportunities, and that's what led me to University of Washington Anesthesia in particular. But there's no shortage of opportunities here, which is amazing.
So, and a strong private practice will also have things like a morbidity and mortality conference and quality improvement programs, and these things that I know your group and my group have. So being at a residency program where those things are fostered and you learn how to do a quality improvement project and how to present at a conference or how to give an educational lecture that'll benefit your colleagues, it's incredibly important. And it's kind of shocking how much it still matters even in the private practice setting.
So, what's your favorite thing about being an attending now?
I love working with the residents. I love getting to teach and getting to share my passion for taking care of kids with the trainees that work with us.
I really love just taking care of people like I'd want to be taken care of, and getting to deliver that excellent level of care, but also tapping into a really strong wheelhouse of clinical skills to be able to maintain multiple subspecialty service lines.
Same here. I love our variety. Speaking of
Yes.
the awesome breadth of training and depth of training that we had at the various sites in residency, it prepared me really well. Truth be told, in our private practice, the acuity and that breadth of depth have definitely lessened a little bit, and that's okay for the most part, because I spend a day doing OB, I spend a day doing my own blocks, I spend a day doing Peds. I use a lot of echoes of all those intensive experiences that we went through, like Rajeev said. You still get to use it all, and now you get to do it on your own, and it's a little scary sometimes. Sometimes pre-op will call me and say oh, by the way, heads up about the third case in your room. It sounds like the situation can be a little bit dicey. Maybe some instructions weren't followed. What do you want to do? And for the first 2 months I was in my job, my instinct was oh, we should tell the attending about that. And then a second I was oh yeah, that's me. That's kind of the fun of it too, though.
I think also I really like as an attending knowing that I have the direct relationship with the patient. It's something that in residency, I think you try your best to really take on autonomy, and you really do. But it is different when you're attending, and the whole thing is there. And if there's, some issue or complication, or you hear about something, you think about it, and you call the patient, and you feel that. But it goes both ways. I think it's really exciting to provide assurance to the patient that you're gonna get great care, and this is what we're gonna do. And and then and meet them, and in a private practice setting, that means, and for me, it could be doing all of them in one case: the A-line, the block, the general anesthetic, and not that you have to do it, and oftentimes you're doing all separate things, but the ability to just sort of feel like I have the complete ownership over that relationship is really nice.
Have you guys felt like the first 5 years you've grown as much as residency? I remember people used to say that, and I was always skeptical, but for me it's been this, I do think so differently now than even a few years ago.
I think that was both a hard part about becoming an attending, and also once I embraced it, a pretty awesome part is this feeling that you're still continuing to grow and continuing to learn. And early on you sometimes have a case when you're I would do that differently next time. And, sometimes I feel you go home thinking about it and feeling a little bit of guilt about your inexperience. But, I think that's an awesome process to keep going through. And I sort of reframed it with my colleagues. We say, I'm going to be such a good doctor someday, all these things that you're learning and growing. And I think that's something you want in a residency program too, is a program that will teach you how to do things you don't know how to do, and how to prepare for a case that you haven't done before, how to prepare for a case that nobody's done before, nobody's seen before, and how to function in that discomfort.
That's a good point to your what you said earlier about being kind of let loose early and having that autonomy early. I feel it has taught me how to seek out my own mentors in my own group, because you show up, you might not know how to do something, and you just learn how to ask questions and how to get a job done.
Yeah.
An interesting way that I'm experienced recently is just like the tests on situational awareness, because I feel like 2 years into private practice, certain things I've really refined, and then I, get credentialed at a new surgery center where we're doing eyeballs all day, and retina surgery is stuff that you don't really do often day in and day out in residency because it's all outpatient. And then suddenly you realize, wait, this is a whole sector of patients with their own needs, and I'm the only anesthesiologist in the building, so my approach to everything is a little bit different. And every time you go to a new place, you modify it. And so I'm pretty certain that lifelong adaptation continues, because suddenly you come in and a drug is short, there's a shortage and you don't have it, or some center doesn't have a fiber optic scope present, or these situations that keep you on your toes and kind of allow you to keep modifying your practice.
I had a case yesterday. I got asked to do an urgent emergent add-on. A gal who had a complete lung whiteout from an obstructive pneumonia. She was on BiPAP, complete respiratory distress, and they asked me to go intubate her in the step-down unit so that we could get her down to the OR. And I 100% channeled all of my UW airways. Seriously, because I was in a step-down unit, wasn't in the ICU. Made sure I had, everybody had their exact instructions, and I had all my helpers, but it was just right back in my shoes as a UW resident carrying the airway pager. But the skills are they're there when you really need them.
I think we're about out of time, but thank you all so much for coming and talking to us about your experiences after graduation from UW, and we really appreciate it.
Good to see you guys.
Yeah.